Hello students, today I will discuss one X-ray plate which belongs to the lower part of the abdomen and upper part of the thigh. And to describe any X-ray plate, we must mention three important points. Number one, what is the region of the X-ray, and number two, what is the view of the X-ray, and number three, what is the type of the X-ray. So this particular X-ray film, it is the region of bony pelvis and upper end of the femur, and it is a plain X-ray or straight X-ray of antero-posterior view. What are the important structures we will see in this X-ray film? And in this X-ray film there are so many radio opaque areas or white areas, and there are so many black areas, they are radiolucent areas. So we will discuss what are these radio opaque structures and what are radiolucent structures. Let us discuss first the radio opaque areas, and this radio opaque structure is the hip bone of this side, and this is the hip bone of this side, and in the midline all these are the lumbar vertebra. We can see the fourth lumbar vertebra and fifth lumbar vertebra. Then below is the sacrum. Sacrum, it is a vertebra which is consisting of 5 sacral vertebra. The 5 sacral vertebra fused to form the sacrum, and below the sacrum is the coccyx or coccygeal vertebra, which are 4 in number, which fuse together to form one piece of coccyx. So we will see the different joints between these bones. Another radio opaque area is the upper end of the femur. Then what are the things we will discuss? Here in the lower part of the vertebral column is the lumbar vertebra, fifth lumbar vertebra and fourth lumbar vertebra, and these projections are called the spine of the lumbar vertebra. And here there is joint between the fifth lumbar vertebra and the first sacral vertebra, forming the lumbosacral joint, and this part of the hip bone is called the ilium, the larger part, and the upper border of this ilium is called the iliac crest, this one, iliac crest. And if you trace it anteriorly, we will see one bony projection called anterior superior iliac spine, and below it is the anterior inferior iliac spine. Similarly, on the posterior side, here if we see, there is one bony projection here, that is called the posterior superior iliac spine, and another bony projection here called posterior inferior iliac spine. And below the inferior iliac spine there is a notch. This notch of both sides called the greater sciatic notch. Lesser sciatic notch will be below. This part is the ischial spine, this small bony projection. So below this is the ischial spine of this side. Below the ischial spine is the lesser sciatic notch. So there are two sciatic notches, greater above, lesser below, and in between is the ischial spine, and below it is the pubis. This is called the superior ramus of pubis, and this is inferior ramus of pubis, and this is symphyseal surface of the pubis. This symphyseal surface of this side will articulate with the symphyseal surface of the pubis of this side, forming a joint. I am coming to the joint later on. Let us discuss only the bony parts first. This part is the ischium. So this whole thing is called the ischiopubic rami, and this projection is called ischial tuberosity. Ischial tuberosity is the lowest part of the hip bone, and when we sit, the ischial tuberosity, it transmits the body weight. But in standing position, the weight transmits from the vertebral column to the sacrum, then sacroiliac joint, then to the upper end of the femur, then through the neck and shaft of the femur. In this way, ischium and pubis, and in between these two is one foramen is there. This foramen, it is called obturator foramen. The shape of the foramen differs from male to female. Then come to the femur. The femur, here is the head, The globular size is the head, then it is the neck, this is the greater trochanter, this projection, and the smaller projection is called the lesser trochanter. In between these two trochanter, posteriorly there is intertrochantary crest. This one intertrochantary crest. But anteriorly, between this greater trochanter and lesser trochanter, one line is there called intertrochantaric line. So, if you are asked what are the parts of femur we can see here, the answer will be head, then neck, greater trochanter, lesser trochanter, intertrochantary crest, and anteriorly will be intertrochantary line and upper end of the shaft of the femur. But in the neck, we can see some bony trabeculae. They are thin and they are extending from the cortical part of the linea aspera of the shaft of the femur up to the neck, and this is called calcar femorale. The importance of calcar femorale is that it gives strength in osteoporosis in the old age. It makes the neck susceptible to fracture even with minor trauma. So, calcar femorale is a very important part of the neck of the femur. Then come to the bony pelvis. If you are asked what are the bones forms the bony pelvis, the answer is very simple. Anteriorly and laterally, the hip bone of both sides, sacrum and coccyx in the posterior side, and this line is the pelvic inlet. I described the landmark of the bony pelvis and its pelvic inlet and outlet in my previous video. Then what are the joints we can see in this field? Here is the joint between this fourth lumbar vertebra and fifth lumbar vertebra. So, this joint is the in between the two lumbar vertebra and it is the intervertebral disc, the secondary cartilaginous joint. Here joint between the sacrum and the lumbar vertebra. This is sacrum, this is fifth lumbar vertebra. So, lumbosacral joint. Again it is a secondary cartilaginous joint. Here is another joint between the pelvis of hip bone of both sides called symphyseal joint, and this radiolucent black area in between the pelvis is the joint space. Joint space actually it is found by the intervening cartilage. Cartilage looks black or radiolucent, so it looks black, and this space it is about less than 5 millimeter, and this joint is called the sacroiliac joint between the ala of the sacrum and the ilium, forming the sacroiliac joint. So, sacroiliac joint it is also a synovial joint, and here the joint space is very thin. You can see the joint space. The joint space, this black area, it is about 2 to 4 millimeter, and this joint also a synovial joint but plain variety. This joint actually it gives strain to the joint, not mobility, because the weight transmits from the vertebral column to the hip bone through the sacroiliac joint. So, it provides more strength than its mobility. Then come to the hip joint. Here it is the acetabulum or acetabular cavity of the hip bone, and it is the head of the femur. This forms the ball and socket type of synovial joint. So, free range of movement can be permitted in the hip joint because it is the multiaxial ball and socket joint. The head, trochanter, greater and lesser both, when do they appear? The head of the femur, it appears after birth during the first 6 months of life. So, this epiphysis, it is the epiphysis of the upper end which appears first, followed by the second epiphysis for the greater trochanter which appears during the 4th year of postnatal life, and the lesser trochanter it appears last for the upper end. Here the epiphyseal center appears during the 12 to 14 years after birth. So, all these three are the three epiphyses for the upper end, but they appear at different ages of life. Here is the neck. Neck is nothing but the continuation of the diaphysis. So, here will be the epiphyseal plate between the neck or diaphysis and the head. So, there will be fusion between the head and neck. Here greater trochanter, and this is shaft of the femur. Another epiphyseal plate or epiphyseal cartilage will be there, and for the lesser trochanter another epiphyseal plate will be there. So these three epiphyses will unite with the diaphyses separately and different ages of life. So all these three epiphyses, they are the examples of simple epiphyses because they appear separately and also they join separately at different ages of life after birth. Unlike the upper end of the humerus, where the upper end is called the example of compound epiphyses because there the epiphyses for the head and greater tubercle and lesser tubercle, they first unite together to form a single mass of epiphyses. Then by a single plate of epiphyseal cartilage, they are separated from the diaphyses and joined together. But here separate plate is there and joined separately. So this is simple epiphysis. And sometimes one question is asked, what is neck shaft angle? If I draw a line which is the long axis of the femoral neck and the long axis of the shaft of the femur, the angle between these two axes is the neck shaft angle, this one. This neck shaft angle or angle of inclination, normally in adult it is about 125 degree. But sometimes this angle may be increased or decreased due to some different clinical or pathological condition. If the angle is increased, that means if this line becomes like this, so this angle is increased, this is called coxa valga deformity. And if the angle is decreased like this angle, so this type of deformity called coxa vera. So coxa vera and coxa valga are the different deformities when the neck shaft angle are decreased or increased. Then what is the type of the epiphysis? The head of the femur, it is an example of pressure epiphysis because the weight transmits to the head. These two trochanters, they are the examples of traction epiphysis because they are formed due to the pull of the muscle or traction of the muscle. So they are the examples of traction epiphysis. If at one bone there are multiple epiphyses, the pressure epiphysis appears first, followed by the traction epiphysis. Another important part is the subpubic angle here in between the ischial ramas of both sides. This angle is called the subpubic angle, which is about 50 to 60 degree in males, and in female it is about 80 to 90 degree because of wider pelvis in female. Another important question sometimes asked, what is sentence line? Sentence line, it is an imaginary line which is named or described by an English radiologist, Edward Warren Hine Senton. The sentence line, which is a continuous curved line along the upper border of the operator foramen and then along the inferior border of neck. So this line, this continuous curved line called sentence line. Then what is the importance of the lines? The interruption of this line may occur due to fractured neck of the femur and also some developmental dysplasia of the hip. And it may be asked, what are these black areas? These black areas, they are radiolucent areas. They are produced due to the gas inside the intestine, because the small intestine also they lodge in the pelvis. So the gas inside them found as radiolucent areas or dark areas. So all these are important questions and answer for the except plate. Thank you very much.